we have two experts tonight who are excited to be here, highly qualified to speak on this topic. Just reading their bios, I thought, man, I'm thinking of so many questions just reading their bios. So I want to share a little bit with you about each one of them. So the first one is Dr. Gary Kleiner. Welcome, Dr. Kleiner. We're so glad you're here.
Thank you. Happy to be here.
And Dr. Kleiner is Associate Professor of Pediatrics at University of Miami Miller School of Medicine. He's also the Director of Pediatric Allergy and Clinical Immunology. And he has spent some time all over. He was in New York, and he also pursued a pediatric hematopia, he's going to have to correct me on that, I'm sure, stem cell transplant at Duke University. And he joined Jackson Holt in 2001. So for 20 plus years, you've been at Jackson, which is great. And he serves as the director of the Jeffrey Modell Diagnostic and Immunology Research Center. He's the director of the Food Allergy Care Center of Excellence and the director of the NIH Primary Immune Deficiency Transplant Consortium Center. So he has got so much expertise to offer us tonight. And he also serves as the immunology expert for the state of Florida, the Department of Health, so Newborn Screening Advisory Council. So a lot to offer there. And throughout the pandemic, he and his team have performed pivotal research, and they've received national press coverage in the COVID treatment, prevention, NIH vaccine trials at the University of Miami, and his team is embarking on a novel food allergy therapeutic trial. So maybe we'll hear about that tonight, that offers hope to patients with multiple food allergies. This is my husband. So I want to hear about this because there's so many things he all of a sudden can't eat. And I think, man, he needs what you're working on. So I'm excited to learn more. Welcome, Dr. Kleiner. We're so glad you're here.
Thank you.
And I want to introduce you to Jennifer Gebbia. She joined the Department of Pediatric Allergy and Immunology in 2016, and she's a board certified pediatric nurse practitioner with over 10 years of experience. And she received her undergrad degree from NYU and her graduate degree from the University of Pennsylvania. And she began her nursing career working at the neonatal ICU and pediatric ICU at Mount Sinai, New York, and later worked as a nurse practitioner at Children's in Philadelphia, Cedars in Los Angeles, and St. Mary's Hospital in West Palm Beach. So she works closely with all the members of the allergy and immunology team, as well as other subspecialists. And she's actively involved in clinical research. And thanks to her vast experience, she has come to understand the struggles that families have with different immunologic and allergy diseases, and is particularly interested in working and finding ways to improve the quality of life for children and their families. So we love that. Also in 2019, she was recognized as Pediatric Nurse Practitioner of the Year. Way to go. And in 2020, she was recognized as Nurse Practitioner of the Month at Holt's Children's. So she remains active as a member of the Alumni Interview Committee for the University of Pennsylvania School of Nursing. So we're so glad that you are here. I want to dive right in, and I want to know, we'll start with you, Dr. Kleiner. So many things that we're going to cover tonight, but I want to know first, what are the symptoms of a food allergy? Maybe someone has never had a food allergy and all of a sudden they're seeing symptoms. Can you tell us?
Sure. So first of all, thank you again for having us. So there's allergies are obviously a huge field, and there are different symptoms that could happen after one eats a certain food. Most people think of an allergy as a classic anaphylaxis, or what we call IgE reaction, which happens. A typical allergic reaction involves multiple organ systems. It can involve the skin. People could have hives or eczema, which is an itchy rash. You could have throatness, tightness in your throat. You could have difficulty breathing, wheezing if you have asthma. Some kids will throw up or have diarrhea. And this could also affect our circulatory system. It could, for a severe reaction, it could drop your blood pressure, lead to shock. And in very rare cases, although actually not so rare, there's about 150 deaths a year in the US from food allergies, but if it's not treated appropriately or recognized, it can be fatal. There are other groups of what the lay people will call food allergy, which classically are not what are anaphylaxis, but those can also affect kids and adults. Usually that'll involve things like a baby having blood in the stool with milk, or it can involve a rarer disorder, something called eosinophilic esophagitis, where babies and young adults can get basically an upset stomach, abdominal pain, they're not growing well. That's not classic allergy. We handle that in combination with the gastroenterologist here, but
Mm-hmm.
it's a big food allergy affects over 32 million people in the U.S., 1 in 13 kids. And the scary thing is over 40% of children will have had a severe reaction. Often it's the first reaction that will bring them to the emergency room. So it's quite common in the community.
Wow. Yeah, those numbers really make you realize how common it is. So talk about the difference. I'm sure there is a clear difference in a mild allergy and a severe allergy, and how should a parent proceed in either scenario?
So it's a good question. We go through this when we try and educate parents how to deal with their kids. If for the type 1 allergy, which is the anaphylaxis one, which most people are concerned about. Usually if it's a mild reaction, it may just involve the skin. Sometimes the eczema, their itchy rash that they have could get worse. Sometimes they could have a few hives. If a child touches a food that they're allergic to, like an egg, if they crack an egg, on their skin, they can get hives at that site. And then for more severe reactions, those kids, their voice may change. They may throw up several times. They may have difficulty communicating. And then that's when the parents have to really act and then call EMS and treat their child.
Yeah, that can be so scary, especially if, maybe it's your first child or, second, third, fourth, whatever, but you've never experienced that before. And then you think, what was it? What did we eat? Where did we go? What did we touch? Like, how do we, diagnose what it was that we got involved in? That can be really scary. I want to know, how young can children develop environmental allergies like pollen or dust or cats? Like, are those developed over time, or those kind of onset initially?
So it does take, the immune system has to be exposed to an allergen to make a response. However, infants can have classic allergies. Usually infants are more to foods,
Mm-hmm.
such as milk, egg, wheat, and soy are the most common. And of course, peanuts, tree nuts, fish, and shellfish. That can happen in a young child or infant. A young child, up to, let's say the first year of life, they'll usually be allergic to things like dust mite, or what are called perennial allergens. The pollens, your trees, grasses, weeds, those will occur usually after about 2 years, 3 years of life, that kids will develop that. But people should be aware that, infants can be tested for allergy. They can develop classic allergy, and we need to be aware that they're out there.
That's good. Thank you. What about asthma? Sometimes I forget asthma and allergies. I kind of, put the two together. I forget that they kind of go together. But when do children typically develop asthma? And is it true that they can outgrow it?
So it's a good question. So in general, about 50% of kids will outgrow the asthma. That's usually the children. There are a bunch of kids that have wheezing with colds, usually a toddler. And those kids that don't have the classic allergy, have what we call the allergic triad, which includes eczema or the itchy rash, asthma, and then food allergies can occur. So in
Okay.
those kids, particularly that have a constellation of a lot of hay fever symptoms, they could have bad food allergies. Those are the ones we think that tend to persist into adulthood.
Mm, mm.
Many people still have asthma that you think they outgrew them, but if we do special breathing tests, there's still some what we see on what's called reversibility. So there's evidence of asthma as we get older. But the good news is that the majority of kids it does get better as they get older.
Interesting. So you're saying if you have that triad, you're a little bit more maybe presupposed to have allergies later in life as well. Did I understand that right?
Correct. Meaning the asthma would persist.
Yeah.
We know that kids get sensitized through foods, through their skin, so that in general, we see a lot of kids that present with the first episode, let's say peanut allergy, or and usually we believe that, or we know that the immune system is sensitized through the skin. So Jennifer will probably talk later, but there's a lot of data now coming out with kids with eczema, how we actually treat them and introduce foods early to try and prevent that sensitization from occurring, and hopefully prevent development of all the allergies as we grow.
Okay, great. All right, I'm getting a question from our audience. What age can a test be done, for children, like an allergy, a food testing, is there a difference between food and environmental and a different age that we need to test those children? I know you said those can develop at different ages. So
So,
when can that be
so
done?
it's a good question. So we actually can test an infant.
Oh,
Oftentimes, if
wow.
we have an infant that we're not sure if they're allergic to milk or definitely egg or wheat, an infant could can undergo skin testing. There's advantages of disadvantages between a blood test versus a skin test. In general, we use the skin test for screening. It's more sensitive.
Okay.
And then particularly for early peanut introduction, which we'll probably talk about later, in that case, we can use either. But you could test essentially a newborn or a 1-month-old if you had to.
Wow.
We obviously wouldn't test an infant for pollen allergy because they wouldn't be allergic to pollen.
Hmm.
A young child, or especially when they're starting to crawl, they could be allergic to dust mites actually. So those could be tested at that age.
Okay. And then how do you, let's talk about, what does the test entail and how do you evaluate a child for food allergies? Can you tell us a little bit more about that process?
Sure. So the most important is getting the history from the parents, and if the child did go to the emergency room, we try and review the records to see, was the child wheezing, was the blood pressure okay, what did the baby or the young child look like when the episode happened, because it's often that's one of the most important things. It's helpful also if parents take pictures if there's a rash. A lot of times these kids will get Benadryl in the emergency room and sometimes some steroids. So it helps us determine, like, was it a hive? Is it just eczema? And after that, then depending what actually happened to the child, it kind of depends on whether we're in the anaphylaxis, that the classic IgE mediated, or the other group, which is the non-IgE mediated. Classically for allergy, at that point, we would move on to either skin testing or blood testing.
Okay.
Um, and then depending on the results, we actually could perform a food challenge in the office where we actually give the food and observe for a reaction.
Okay. Okay. Wow. And I would assume initially, if a parent has a concern, your pediatrician is kind of the first place to start, right? And then they refer you maybe to an allergist or.
Yeah, and then we have a very good relationship with all the children's ERs pretty much in South Florida.
Right.
So that if a child, because most of the time these kids will show up in the emergency room after anaphylaxis,
Right.
whether it's a bee
I'm
sting
sure.
or peanut or something. So most of the time those children or those families are referred, or they'll contact us through one of the national organizations.
Mhm.
It's very important if parents do go through an emergency room and let's say they're prescribed an EpiPen. There have been multiple studies published showing that most of the time the parents have no idea when to use it, what to expect to use it. So oftentimes, like the first visit to any real allergist, a pediatric allergist, parents find it quite helpful because we go through, we have forms, pictures and things that we show them exactly like this is what you do. We give you a plan. So,
Yeah.
which, I think is the most important. So you know what to do the next time.
That's great. Yeah, it can be so scary. So to have a plan is so helpful. That's great. Okay, I received a question from the audience. This one's a little specific. I know sometimes we can't speak necessarily, can't diagnose and whatnot, but this question says that their 16-month-old is allergic to penicillin. Is this something that she could grow out of? And she was told that trial and error is the only way to know. And I think the mom's like, well, when do we try again? That's kind of nerve-wracking to think, when do we
So,
try?
so it's a good question. So, the majority of kids do outgrow penicillin allergy.
Okay.
Penicillin and a lot of drugs cause different types of reactions. So it can cause, oftentimes a child will have like a virus and the pediatrician will give them an antibiotic for some reason, and that itself can cause a rash,
Okay.
particularly with some of the what are called cephalosporins, which
Okay.
is a group of like antibiotics that are not penicillin, not like amoxicillin, but other things can cause rashes. So it's important to kind of understand like when the rash occurred, what reaction happened. There is testing for penicillin that could be done. It gets a little bit more complicated because it's a little bit more involved, but most doctors will wait a little bit if it's a toddler. The only caveat would be like if the child, let's say it's a transplant patient, they have heart disease, and there's a chance that they may need penicillin, IV for whatever reason. In that case, occasionally we would do like an earlier test, like a child with
Yeah.
cystic fibrosis that needs a lot of different antibiotics. That's when we would test that child much earlier.
Yeah. Okay, great. Thank you. Okay, a couple more. I'm rapid firing some more at you here. One parent says that her 4-year-old son, the pediatrician sent him with, I guess, an EpiPen to avoid having a major allergy with peanuts, but they haven't tested him. So she's like, well, how do I know to reach more information? Would you suggest that's when you visit an allergist to say, let's just examine this a little bit more?
Correct. And then also, we try and avoid people being labeled with an allergy if they don't really have them. Oftentimes, if we're not sure, we'll move to a food challenge.
Okay.
The food allergy, food is supposed to be comforting to us. And we're seeing, unfortunately, a lot of anxiety, both in the parents and children, and it's affecting quality of life. So our goal in all of medicine, I guess, is to try and make as normal life as we can with the least restrictions. So oftentimes, if the parents are willing, particularly for tree nuts, let's say, in general, you're not allergic to all the tree nuts. So if the parents, there are obviously foods that are safe to give if we tell you you're not allergic, but then Jennifer and the nurses sit down with the parents and say, okay, you can eat this and not that. So it gives the parents also and the child some more power to control like what, basically their lifestyle if they want to.
Yeah. Okay. That's great. Thank you. Okay, one more, and then I want to hear from Jennifer too. Okay, one more. So this mom says that her son just Monday had an allergy test, and he first had to control the histamine on his arm. Shortly after, before the allergens were placed on his back, he had a rash that looked like a heat rash, and it persisted, and then all over his torso. And he had little to no reaction to the actual allergens. Is the histamine reaction, is that a normal thing?
Yeah, so the histamine is like a normal, that's the allergist would put, or the nurse would put that on as a positive control. So we have to make sure that the test is reliable. So just like if you take a Benadryl or an antihistamine, that will block that reaction. So we need to make sure, just like the lab checks the machine, if you're having like a blood count to check your hemoglobin, the lab has to check the machine every day to make sure it's working before they report the data. We have to make sure that the person, the
Is
parents
reacting,
didn't
right?
give the medicine that would block it, and then it worked. So
Okay.
there's always a negative, which is usually saline or salt water, and then a positive, and then the allergens are put on.
Okay, that makes sense. See, learning so much, you guys. I say I have the best job in the house because I get to sit and ask all the questions and learn all the things directly from you. So this is great. Thank you. And just to our audience, if you have a specific question at any point, drop that in the Q&A and I'll get that in front of Dr. Kleiner and Jennifer as well. So, okay, Jennifer, I have a question for you. Is there anything that we can do to prevent our children from developing an allergy?
Yeah, so that's a good question. So the strongest data that we have comes from the LEAF trial, which looked at basically trying to prevent allergy, particularly to peanut and egg. And what we know from the trial is early introduction of peanut and egg, particularly, around 6 months, not earlier than 4 months, is most beneficial. And that was particularly looked at kids who have, say, severe eczema, have an allergy to peanut or egg or to both, or a sibling, say, for example, with, a food allergy. That's where we have the most data. We do, like Dr. Kleiner said, try to work closely, especially like with infants who either have, severe eczema. As I said, foods can, become sensitized, or you can become sensitized to foods through the skin. So early, testing and then identifying, possible allergens, and then giving, guidance to parents in terms of like what foods would be most important to introduce at what time. Right now, there are different products, like particularly say you're looking at peanut and egg. There's products both that are commercially available as well as, stuff that you can make like in your own house, so thinning out peanut butter or using like Bomba or peanut puffs and dissolving them to, to a consistency that your, 6-month-old or your infant can tolerate, as well as other products that are available, such as like Spoonful One, Ready, Set, Eat. There's little mix-ins that are available. Those obviously are more expensive, but they are helpful in terms of if you do have a high risk of developing, say, a food allergy, getting multiple foods in at one time and at an early age is very helpful.
That's great. I know with every baby, I was always like, I know I need to do this. It just, you feel like
It's scary,
very.
absolutely. Yeah, and especially if you've had an experience in terms of like you've already had one reaction or allergic reaction, it's very frightening, especially, you're at home, you're by yourself, you don't have the same resources, that you would being like in the ER in a hospital type setting. So it's, trying to sit with the families to look at like, risk and benefit versus specific foods. And then, at what age is important to get those introduced is really essential.
Yeah. I always reminded myself, I would rather be the one introducing this than like grandmother's keeping the baby and she gives them
Yeah.
a spoonful of peanut butter or something, heaven forbid, and I'm not there. So it's like, okay, coach us through our fears. We can do this. But I love that, the early introduction. I remember the pediatrician saying that. And I forget about eggs. Peanut butter is kind of a big one, but
Yeah.
like you said, eggs as well. And I
Peanut
think
and eggs are essential. Yeah, absolutely.
great. Dr. Kleiner, we talked a little bit about this, but maybe elaborate on what are the chances that our child will outgrow an allergy?
So for food allergy, it kind of depends on the food, and we're learning more about that. In general, for peanut, it's about 20% of kids will outgrow their peanut allergy. Um, for egg and milk, the data is better. It's generally about 85% by age 16, let's say. Most kids, I'd say that the majority of kids will outgrow by probably by 6 to 10. The other thing that people may not understand is that the food allergens are kind of like three-dimensional, just like we have backs and fronts and sides. So the immune system recognizes the protein in 3 dimensions. So oftentimes, like a child may not be able to tolerate scrambled eggs, but if you give them a muffin or a cake that's baked, or milk that's that's baked in a cake, let's say, they're able to eat that. So we work with them based on some blood tests and with food challenges, and try and get those foods in sooner rather than later. We know that helps gets the kids to outgrow the allergy faster. For some of the other allergens, like let's say for seafood, shrimp and lobster, things like that, it's lower. It's about 8%. And then some of the other foods like sesame, there's really like 9 top allergens: the milk, egg, wheat, soy, peanuts, tree nuts, fish, shellfish, and then sesame is number 9. For those that are used for parents that have a child that has a food allergy, it's very important how to know how to read labels, and then what the labeling actually means. May contain usually means that they can eat that product, but essentially, like sesame is less likely to outgrow. We're hopeful that as as new therapies come on board, this won't be as important, but it's important. We always try and give some good news to parents, and we never really throw in the towel, and we've seen children outgrow even in teenagers. So I really never give up. If we have.
That's great. That's great news. And we're talking specifically about pediatrics here, and I'm going to deviate a little bit. I said at the beginning, I'm like, my husband is the one with all the allergies, but it makes me concerned for my children because I think, oh, well, is there a correlation? Is this hereditary? Like, if you can't have a banana, do I not need to feed a banana to my child? But all of his were onset in adulthood. We're talking about what are the chances of kids growing out of them, but again, I guess things can onset later in life too, right? Like they can have a fine childhood and then.
And there's Dr. Gupta, who's from Northwestern, published a very large series from a national poll about 2 years ago. It was right around COVID when it started, just calling patients with food allergy and looking at the major allergens in kids versus adults. And also, so it's interesting that tree nuts and shellfish actually in adults can happen later. So, and we really don't understand why. There's some theories about it, but no one understands why. Those unfortunately tend to persist if you develop as an adult. And they can be sometimes more severe. Shellfish and fish gets a little bit more hairy because those are actually can be airborne. So it's important to give good counseling if someone really is allergic to those allergens.
Yeah. Interesting. There's so much here. I'm like, we could do a whole series on just this topic. This is great. I received a question from a mom. Is there any correlation between breastfeeding and helping a child avoid an allergy?
So unfortunately, no. We thought that food allergy would be prevented by strict breastfeeding. It does play a role in helping eczema, which is indirectly correlated with food allergy. But there have been multiple international studies published, and obviously breastfeeding is best and we recommend that. But in terms of food allergy prevention, early introduction and good skincare and hydration seems to be more important.
Okay, great. And on the topic of eczema, we received the question, when does baby eczema go away? And like, how do you know if it's being caused by general exposure to this great big world or if it's food or environmental?
So that's when the testing comes in. And also there's other rashes that can look kind of like eczema. Usually in young infants, it'll be mostly on the face or this part, the extensor surface of the arm over here. And
Right.
then the eczema tends to move in older children and toddlers. It'll be here in the in your forearm, the bending of where you put your arm behind your knees.
Okay.
So by the distribution, that's helpful. And then of course, there are a lot of triggers of eczema. Food allergy is one of them, or can be. Regular allergies like to dust it can be important. And also kids and adults can also can be allergic to staph. Not the bacteria itself, but the bacteria can secrete certain chemicals that we can become allergic to. So we have to try and look at all of the factors and address them.
Yeah. Okay, that's good. I'm thinking about my little guy too. I have a 17-month-old and he developed like a little rash on his outer thigh. And I thought, oh, it's just, I always say, oh, it's eczema, because the pediatrician will say it's eczema, it'll go away, and then I'm like, but wait, how do I know? And it's something, especially at the age where he's eating all kinds of things and he's being exposed to all kinds of things. So it's like, how do we strictly, kind of watch for that? So again, what you're saying, the testing and looking at all the elements. So that's great. Thank you. Our audience has so many good questions tonight. I have another one. And this one says that we have begun introducing allergens to her son in the past couple of months. Twice, egg has given him a mild reaction around his mouth, no other symptoms or reactions. Is it advised that the allergen be stopped even with a mild reaction like that? And this mama says, or can I keep feeding him egg, which is her favorite food? I know I have a kid who won't eat egg and I'm like, but it's the best and you're not even allergic, eat it. But what would you say to her?
So at that point, I think if it's happened more than once, I would probably recommend talking to the pediatrician about getting, even a blood test or a test just to make sure. There is a kind of like what we call a dose response curve to food allergies, so that like even a child, if you're allergic to peanut, a small, not saying you would do this, but a very small exposure wouldn't cause you necessarily to have full anaphylaxis. But if you're exposed to, let's say, a candy or a cookie or something that has a lot of allergen in it, it can cause a severe reaction. So, especially as you're starting to feed an infant, it's important to kind of gauge like where you are in terms of the scale and is this really how serious could this potentially be?
Yeah. Okay.
Yeah, and one thing that Dr. Kleiner mentioned too, just to follow with that, is the importance of testing and how it can be helpful, particularly for food like say egg or milk, when there's various forms in terms of like a baked version of the food versus more of like a raw version. So raw we consider like scrambled egg or hard-boiled egg. So even if you do have the testing, it can be also helpful to kind of determine whether or not we can move toward, like if they can't tolerate say the scrambled egg, but then maybe we can continue to introduce like a baked form, which with the goal then of hopefully outgrowing the allergy later on.
That's great. That's great. I have a friend who has twins. Our girls were born weeks apart, 2 weeks apart. And her twin girls had a peanut allergy, but they did, you guys know what it's called. I don't know what it's called. I want to say it was like IAA. There was like a letter for it where they started introducing, what is that called?
OIT.
Yes. And yeah. And so they started slowly kind of introducing more and more to help them through that allergen. So it's so interesting because it's not just, okay, you can never again forever have this thing, perhaps. Like you're saying, it sounds like a lot of the cases can be very unique. And so the importance of seeing a professional, that's what I'm gleaning right now. This is so good. What disorders may benefit from a referral?
So allergy or immunology covers a lot of the different basically all our organ systems. In general, severe asthma, someone who has really bad eczema, someone who has like obviously like a reaction to a food or an anaphylaxis type reactions, like let's say peanut or something. Oftentimes it's a lot of information. There's a lot of apps and websites that people find or that we find are quite helpful. It gives people, parents, some empowerment to kind of deal with this. Unfortunately, there's a lot of I don't want to say like incorrect information, but everyone's problem is unique. And sometimes by, just Googling and looking up on the internet, you'll find things that would, or they're outdated or not necessarily applicable to you. So I think it's in those are the main ones. Certainly our practice also, we see a lot of kids that have a lot of infections because we have a lot of specialty with the immune system. So we're focusing obviously mostly on allergy today, but if your child, unfortunately, like let's say was admitted to the hospital and has like a horrible pneumonia or an infection in the bone or something like, and you don't know why they're getting sick a lot. Those are other disorders that are handled by the clinical immunology service.
That's great. That's
Yeah,
great.
and other things too that we see often too, just more severe kind of seasonal allergy symptoms that you might think about. So, beyond the part of, just trying the over-the-counter medications, right? Coming to the office so you can get testing done to identify the triggers, and then really kind of honing in on treatment options, whether it's environmental controls or over-the-counter medications or allergy injections, to desensitize you to the environmental allergens. Recurrent like rashes, like hives could be, another reason for a referral, trying to identify the reason for hives. Like Dr. Kleiner said, the asthma, the food allergies, all could be, good referrals.
That's great. I always say there's no need to go to Dr. Google when you could come right here and speak to the professionals and ask your questions. I'm like, if you have a question, just go look in the resources in the archives at jacksonevents.org and get it from the source. I mean, we've all done it. We've all Googled something at midnight because we're feeling nervous and anxious. But you can diagnose yourself with anything if you search hard enough. So that's a good reminder to seek out professionals. Let's talk about allergies. It can be life-changing, and especially for our little people. And they're in context of school and sports and all the things. So what do you suggest us communicating with the school if our child has food allergies?
So for food allergies, you want to?
Well, I'd say that we go, Jennifer and Maria, our registered nurses, go to schools. I mean, before COVID, obviously. We've given lectures in schools with school nurses and things to try and get, there's a lot more awareness, thankfully, of food allergy in schools. The Food Allergy Network, which is foodallergy.org, has a lot of information for schools and for parents, and actually a program that a school, if they wanted to, could get certified in.
Oh, cool.
That, it's much better now than it was 10 years ago. One thing I would say, like as a parent, though, it's very important to kind of think, just like you baby-proof your house. A lot of times, like you may have an EpiPen in school, and let's say your child is doing soccer. It's very important if your child has like a food allergy that you plan that the EpiPen is in, the soccer bag. So it follows the child as they go through their day, not being, locked in, let's say, the nurse's office or the front office. That's good. There's a lot of practical things that people may not necessarily think about that, it's more on the nursing side. I'd say Jennifer and our registered nurses do that very well, but it's important to kind of think about all those scenarios.
Definitely.
Yeah, I mean, just like Dr. Kleiner mentioned, I mean, definitely setting like the expectations with the school, whether it's like the teacher, the administration, the school nurse, whatever the resources that are available, even prior to the school year, I think is most important. Just like Dr. Kleiner mentioned, making sure that you have the auto injectors, whether it's EpiPen, Auvi-Q, making sure that they're up to date. There's 2 that are going to be with the child, and then also making sure that there's a food allergy action plan that's provided to the school with not only, the up-to-date allergens, because, allergies, like we know, can change. A child might outgrow an allergy or, maybe still avoiding, or may develop a new allergy. So making sure it's accurate, it's up to date. And then reviewing with the school, what's the policy in terms of who can recognize an allergic reaction, especially for like our younger kids who, might not be as aware. And then where the EpiPens or the auto injectors are going to be kept, whether if they have a nurse or if they don't have a school nurse, are they kept in the classroom? Are they going to be kept with the child at all times? And then also who's really feels comfortable in terms of administering the auto injector, because people are trained, but they might not feel comfortable in terms of like actually when there is an allergic reaction. So kind of having this set up in place in terms of like a plan in place. And then just as Dr. Kleiner mentions, if your child plays sports, or if they're on a field trip, or if they're on the bus, going home, like what's the policy in terms of, is there no food on the bus? Or, if the child were to have an allergic reaction, what are the kind of policies that are set up? And then, what you can do and how you can work with school in developing a 504 plan so that, your child feels comfortable, but then also, as a parent, your goal is to be able to provide like a safe and, confident environment for your child to be in school. So kind of setting these expectations, I think is most important. Other things to think about would be, so say, sitting with the teacher at the beginning of the school year to develop like a safe party, either like food list, in terms of whether it's, only bringing in like, these prepackaged foods that we know are safe for all the kids in the classroom, or just developing like a no food policy, whatever it is, and you use, I don't know, other like little like treats instead of, food items in the class, are really important. Different things, also to consider when you're writing up like say you're developing a 504 plan with the school, just to keep in mind is, they've shown that eliminating, say, an allergen, or just saying like we're going to be a peanut free school, doesn't necessarily decrease the risk of anaphylaxis, because people forget, people make mistakes, food can be brought into the school at all times. Yeah. And the same thing in terms of, with specific seating arrangements, like having a nut free table or having, like a milk free table can also, it presents concerns of social isolation. So just as a parent, there's other things to think about in terms of, when you're sitting with the school, like what, really, I guess, thinking what would be best for, like your child based on the age and developmental level of what you really want to ask for.
Right. Oh, that's good. And advocating for our children, it's not just signing on the form, oh, we have an allergy, but really advocating, like you said, giving ideas of how we can do things differently. And my next question is along those lines of like, what about taking a child to like a restaurant or a birthday party, or, making those accommodations where they can enjoy the social outings and the gatherings, but that they're safe?
Yeah, absolutely. I mean, I think it's also really important too, like you were saying, empowering is also time to use these experiences to empower your child to really start to advocate for themselves, right? And whatever their developmental age and developmental, or developmental level is, in terms of like having them start to, ask questions in terms of like reading food labels and, being confident in terms of saying, I have an allergy to, eggs. And, starting that at a young age is really important, because it kind of like takes away the stigma of like, oh, I have a food allergy. Dr. Kleiner mentioned 1 in 13 kids have food allergies. So it's, it's common, and it's something that we want to, like I said, to really empower the kid to feel like comfortable and confident that they can, have a successful life with food allergies. So with the school, or if it's, like picking a restaurant. So there's a lot of, tools now that are available online. There's Allergy Eats apps, which has a great resource in terms of like finding whatever your allergen may be, whether it's shellfish or fish. They have a list of restaurants that are available. And then definitely, absolutely, planning ahead is always important. So calling the restaurant ahead of time, speaking with either the chef or the manager to talk about, the menu in more detail in terms of how, what are the ingredients, how is the food prepared, what's, risk of cross-contamination, so that you can kind of go, maybe if this is a parent, say in a child situation, you can go already be kind of prepared of like, these are options that I can offer to my child, so they feel like they can be part of, the normal dining experience where they can choose, maybe one of the 3 things off the menu. And then absolutely, of course, declaring your allergy again once you arrive at the restaurant, and with each of the the team members that might be there to serve you, whether it's your initial waiter or the servers that come, just reinforcing what your allergy is as well. And then lastly, absolutely always making sure that you carry the autoinjector. So really, that is something that's so important. Dr. Kleiner had already talked about this as well too, in terms of anaphylaxis. It is a risk with food allergies. It's it's unpredictable. We don't know when it's going to occur. We don't know what the severity is. So being prepared and always carrying the autoinjector with you is the most important thing that you can do. It's life-saving.
Yeah. For sure. And we're getting some questions about that. And we're going to get more into it here in just a minute. There's just so much here. It's all so good. While we're on that, we're talking about school, we're talking about restaurants. What about travel? Do you have suggestions for like when you're traveling with a child with food allergies?
Yeah, so same in terms of absolutely always bring an auto injector, especially going to be traveling. Absolutely bring 2 auto injectors with you. So your kit comes with 2 auto injectors and the the trainer. Definitely bring both of them with you, and then also make sure that you're either bringing in like the original package that has the prescription on there. So when you're going through like TSA or security checkpoints, or bringing a physician note, signed letter that gives you clearance basically to carry the medication is important. If you're traveling, or definitely, if you're traveling on the airlines, don't obviously, put it in your checked bags, keep it with you, carry it with you on the plane. If you are traveling to an international destination, some things that you might want to consider would be making sure that you know how to contact emergency services. And then also like what would be the nearest emergency room just in case you had an allergic reaction. And then also being prepared in terms of if it's a foreign country and you don't speak the language very clearly, either bringing cards that have the allergen or the food that you're avoiding in the actual language or in the country that you're traveling to. On the FAIR website, they do have allergy cards. So if you're allergic to eggs and you're traveling to I don't know, Spain, you'd have, like huevos written on there or whatever it might be. So making sure that you can communicate very clearly with, with the servers, the hotel staff, wherever you're staying, or just taking like screenshots on your phone, just to make sure that that's available.
That's very
And then in terms of,
good.
yeah, so I mean, it is helpful. And then in terms of airline travel, declaring your allergens ahead of time is important. However, even with that, be very cautious if you're going to, eat the food on the plane. So, oftentimes you can request a specific meal ahead of time, but, people switch seats and there's, obviously, there's always human error in terms of what food gets passed to the specific individual. So, just bringing your own food to be safest is essential. Checking for different like food residue when you get onto the plane, making sure you wipe down the seats, wipe down the tray tables. And then again, like we said, always carrying your auto injector.
Great. Oh, that's so good. Great tips for travel. I love the translation thing. I never think about that. If you're going somewhere with
really
a different
helpful
language, have it so clear. Okay, we've got some audience questions. So I'm going to interject some of those here now. Okay, first one is, does taking honey help with pollen allergies?
So there's a lot in the lay press. In general, no, the concentration in the honey of the pollens is not particularly high enough to necessarily desensitize. Also, if your stomach is digesting it. The other thing is the pollens obviously change for where you live. So the pollens here in South Florida are different than Northern Florida because of the trees and the grasses and things like that. So it probably isn't that helpful.
Yeah. Okay. Along those lines, talk about dust allergy. One listener, I want to say mom, but I'm like, I don't know if you're a mom. You might not be a mom. One listener wants to know, can changing air filters and removing carpet in the house help with the dust allergy?
Yeah, absolutely. I mean, dust mite allergy. So like Dr. Kleiner mentioned, I mean, dust mite is the most common, year-round allergy. So it's very prevalent. So some tips for dust mite, definitely adding dust mite allergy covers, both on the mattress and the pillowcase. Dust mites get embedded into the mattress, into the pillows, and they're very difficult to clean. Yeah. So starting with, depending on like if it's for, an adult or for a child, usually like the younger, like under say like 3 or so before they're potty trained, you have the plastic mattress, but after that, making sure you add the dust mite covers, those are extremely helpful. Eliminating carpets, curtains, stuffed animals. So limiting stuffed animals as well is also really important to help with dust mite allergen. If your child absolutely needs, the stuffed animals, you can move them to a different area of the bedroom, or keep one and then either put it in the freezer and dryer once a week just to help to mitigate the dust mites. Absolutely a HEPA filter in the bedroom, so like an air purifier, just one that's appropriate for the bedroom size. You don't have to go crazy and get something super expensive. It's just one that's fits in terms of like the size of the bedroom. They're extremely helpful. They help to filter the air about 5 times an hour, so they're going to pull out the dust mites, the pollens, different things that are just blowing out of the house, dog, cat dander, those kinds of things absolutely are first line therapy in terms of trying to help with dust mite allergy.
Okay, that's great. All right, this sounds like a mom hack, but talk to me about the freezer. You said putting the stuffed animal in the freezer. What is that just
For
so it
24
can get in
hours.
it? I'm like, why are we putting things in the freezer? But tell me more.
Something small, small enough. We always have to ask, like, okay, what's the size of the stuffed
Yeah.
animal? My nephew has this like giant, what he calls Charlie, and it's like probably the size of me. I'm
I
thinking
love
that one
it. You're like, that's not gonna work.
not gonna work exactly, but something small enough that you can put into like a Ziploc bag and then put it in the freezer for about 24 hours helps with dust mite allergy.
Okay,
Killing the
that's
dust
I
mite.
didn't know that. That's a good tip. I just think wash it, and whatever, wash it in
Yeah,
hot water and be done. But that's good. A
exactly.
good tip.
Yeah.
Awesome. Along those lines, a mom asked a similar question. Her toddler is constantly like rubbing her eyes. And so she wondered, you have carpet, she sleeps with stuffed animals. Could there be a correlation there?
Yeah, absolutely. I mean, especially you see, like cough, lots of congestion, especially like in the morning time after, like the child is exposed to a lot of the allergens overnight. Definitely, would say, further kind of trying to investigate the allergens to know whether it's more indoor allergens or outdoor, like the pollens, weeds, trees, grasses, those kinds of things. Helping to, differentiate between the two of them can then help us to kind of hone in on not only like environmental controls, but then also like what would be the best medication management,
Yeah.
or if medications, she's young, so if that would even be warranted at this time.
Yeah. Okay, that's great. Another question from a mom. This was one that we got earlier. I just want to clarify, make sure that we are answering her question. But she said her son never had an allergic reaction when starting his feeding when he was 6 months old and older. But now at 4, out of the blue by accident, they realized that he may be allergic to peanuts. And the thing about the epinephrine injection scares her without having all the information at hand. She said, I could be more allergic to more things as the years go by and before was not. So I guess maybe just some words of encouragement for her, maybe just using that EpiPen can feel scary. I can't imagine, but talk us through that.
So I think first I would test because it's unclear. I mean, this is an individual scenario, but just to make sure it's not. Oftentimes there's not so much cross-reactivity, but only 7% of kids are just peanut allergic. A lot of kids are peanut and tree nut allergic.
Okay.
And then if you're allergic to tree nuts, there's a 30% cross-reactivity to seeds. So that includes, so like it's important to kind of talk to the pediatrician or a specialist just to make sure you obviously don't want to have an inadvertent exposure that someone's allergic to. Oftentimes, so in a challenge setting, sometimes we'll actually have the parent administer the EpiPen themselves to the child if we need to. Because particularly in a teenager, it's quite scary, but you feel much better if you're actually having a real anaphylactic reaction, difficulty breathing. You'll notice that the symptoms abate very quickly within, let's say 5-10 minutes. And then oftentimes if you just give, Benadryl, it's not really treating the underlying symptoms or treating, inhaler, let's say you start to wheeze. People shouldn't be afraid of epinephrine. It's a very safe medication. We always tell parents that, like, if you're thinking that your child may need it, just give it. I trained years ago in New York City, and they would give, the EMS would give the kids on the street, a shot of adrenaline or epinephrine at the same time they were giving the nebulizer. So, and it was used, not obviously for food allergy. So it's a very safe medication.
Okay.
Obviously, we wouldn't just give it to anyone, but I would say, like, if you know that your child is really allergic, don't be afraid to give it.
That's good.
Save their life.
Safer than the alternative. I know it feels scary, but like, just go ahead and go. I can't imagine. I feel like as a parent, it's scary. I love that you're saying in the office that you have the parent administer, because it's got to give a boost of confidence to be able to, like, I did it.
Absolutely.
I can do this. I can do this.
Yeah, and just practicing, they give you a trainer in terms of, whether you like practice in the office with the allergist or just, practicing at home, and like in terms of, 4-year-old, 5-year-old, explaining to them, and obviously in a way that they'll understand at this particular age, but explain to them, this is what's going to happen. This is how we're going to sit you, we're going to, put this against your thigh, and, just like going through the steps so that they're aware of what's going to happen. It just, I think it helps to make it less scary for the child, but then also for the parent as well, because, you're practicing and you're giving both of you an opportunity to kind of like figure out how to do it. So when it, if you really need to, then you can feel more comfortable in that situation.
Yeah. While we're on this topic, a couple more questions on this topic. What about the person who maybe says, my insurance deductible copayment is really high. I can't afford an auto injector. Is there something that you would suggest for them?
So the good thing is that there's several on the market, and it's also important. In general, the commercial insurances will cover one. It might be a generic, auto injector, but the companies do provide, particularly if you have commercial insurance, even with a high deductible, it's less than, it depends on the product, but let's say $25-$30 for two. There's maybe a special form that has to be filled out, and it goes to a special pharmacy. So it's important to talk to, the prescribing doctor or the professional, because it may just be going to the wrong pharmacy.
Good. Yeah.
There are also generic EpiPens at CVS and Walgreens that are much cheaper than the brands. So for people, let's say international patients, you can usually find one. A regular EpiPen is about $1,200. So there are generic ones on the market for a couple hundred, and some even less. So that it's important just to do research and just ask.
That's good. That's good. Yes. We're talking about advocating for your children, yourself, your health insurance, all the things. We've got to ask all the questions to get the answers that we need. What age is it safe for a child to start self-carrying that EpiPen?
So sometimes, it depends on, the most important thing you have to consider, I guess, is more like the developmental kind of stage of the child. So depending on, like how comfortable they feel with injecting themselves is also something very important to consider. So usually maybe like around like age like 10 to 12, we can start to have the conversation, but it really, it has to be, there are a lot of factors, I guess you would want to say, in terms of, say, for like a school setting, knowing like what are the backup resources that are available. So even if your child is carrying it themselves, if they, if something happens, it misfires, what are like the resources that are available? How comfortable, does the parent feel in terms of, feeling confident that you can not only recognize the allergic reaction, but then also be comfortable to treat the reaction. So there's a lot of factors that I think we have to take. So it's hard to say like a specific, like cut off age, but some like around like 10, 12 area, we can start having the conversation with parents and the child, of course. Like most important is making sure that we're involving the kid in the conversation, or the child in the conversation, because if they're like, oh, forget it, I'm not gonna, there's no way I'm doing this, then
yeah. We gotta get some buy-in with them. Okay, just a couple more minutes. I want to respect everyone's time. And Dr. Kleiner and Jennifer, we're so glad that you've been with us tonight. A couple more audience questions on the topic of dust again. When is it appropriate to give a child medication against allergies? I think their situation is dust in particular. Is there a certain time that like, okay, give them the medication or not? Wait on that.
So I think particularly for dust, environmental control is the first intervention, and then there's, as Jennifer said, that involves both the bedroom, and things in the house, the stuffed animals. That's important. Often it's more important than just giving drugs. The antihistamines, all you're doing is pretty much blocking the symptoms. So you want to try and address the real problem if you can. You don't necessarily have to go crazy and tearing up your carpeting and all of that, but most people do okay with the environmental controls. The antihistamines, there's several on the market. They're the non-sedating and some of the older ones. They are quite safe if they're given, at the correct dose. And then as the child gets older, let's say 5, 6, if the medications don't work, that's the time that you may want to consider, allergy, immunotherapy or allergy shots if the medicines aren't working and it's really causing some issues.
Great. Along those lines, one guest asked, tied to the air purifier comment, does humidifier work for allergies? She said her toddler kept coughing all night, and so wake up congested. So a humidifier was suggested. And so they started doing that, and it helped with the coughing, but not the congestion. So should she add an air purifier with the humidifier to replace? What would you say?
So one of the problems with the humidifiers is they can create mold. So it's important that the basin where the water is kept, that's actually cleaned with, let's say bleach or Clorox, to make sure, like once a week. They usually come with instructions. Unfortunately, dust mites love humidity. So if the person is, does have dust mite allergy, let's say, humidification is probably not the best thing in the bedroom. Sometimes allergies itself will cause like nasal congestion itself, and also a cough. So you may, it's hard to say, like, I'm not a great fan of humidifiers, at least in Florida or South Florida, because it tends to cause more
Step
issues.
outside. Yeah. Just go outside.
Yeah, exactly.
That's right. Okay, well, RC, our time is wrapping up. Oh my goodness. Okay, I want to ask maybe one more question here. In light of like the formula shortage, what recommendations do you have for children with allergies? And then this, the formula shortage. Sometimes kids need specific formula.
Yeah, this is a really, really difficult, challenging, time for parents. It's extremely difficult. Me and I checked today again this morning, like Amazon, most of the large companies, Target, Walmart, Amazon, are still, most formulas are still not available. So, I mean, some things that have been helpful would be, checking like some smaller stores, more of like local convenience stores, or utilizing online social media groups like Facebook, Instagram, in terms of trying to, connect with other people who are specifically, if you specifically need one type of formula. European brands. So there are some, differences in terms of regulations. I mean, the European brands are not regulated by the FDA. They are regulated by the European Food Safety Agency. So it is a highly reliable, source. But, if you are going to utilize one of the European companies, just making sure you're reading the ingredients very clearly and specifically to make sure there's not, like an allergen that, that may be in one of these formulas compared to what you're used to. There's different websites, like you can go online that you can check to see a comparable formula if you can't get, say, like one specific, to try to find an alternative, which I know is very difficult. And even contacting some of the manufacturers like Abbott, they do have forms that can be completed by the pediatrician for medical necessity. So say, for example, if your child has a specific food allergy, it's another route. It does need to be filled out by a healthcare provider. So it's something else to try, but it's very challenging right now.
Oh, challenging all around. This is so good. This conversation has been wonderful. A thank you to our audience, because they have been so engaged and asked so many wonderful questions that has guided our conversation tonight. I think that that we could do this again and have even more in depth. So I just want to say thank you to Dr. Kleiner and Jennifer for joining us tonight. We're going to put some resources here up on the screen, so you can screenshot this. Those are some of the websites that were mentioned tonight, where you can find more resources and do a little deeper dive on some of the things that we've talked about. But I want to go ahead, before we sign off, can you tell us where you're located and how to make an appointment? If our guests are like, wow, this was so good, but I need more, where can they find you?
Yeah, no, I mean, so our main office is located in downtown Miami at the Bachelor Children's Research Institute. We also do have satellite locations in Weston, as well as in Doral. We see patients weekly at the Jackson Ambulatory Care Center West. We're in 5B there. And then we see patients as well weekly at our Alex's place, which is located on the ground floor of Sylvester Cancer Center. So we have various, clinic sites. And then in terms of scheduling, so scheduling on the UM side, so the University of Miami side, the phone number would be 305-243-8441. And then from the standpoint with Jackson, if you wanted to schedule at our the Ambulatory Care Center, it'd be 305-585-7096, and that goes directly to the clinic there.
Okay, great. Thank you so much. This has been so insightful and helpful. I want to tell you that we are keeping these coming for you. We've got more coming. And so a really important and sensitive subject for our next webinar, which will be Thursday, June 16th. So mark your calendar. It's in 3 weeks. And it's going to be on the topic of miscarriage. So miscarriage is the loss of pregnancy before the 20th week of gestation, and about 10 to 20% of known pregnancies end in miscarriage. This is a staggering statistic. So we always say 1 in 4, like 1 in 4 moms or women have experienced a miscarriage. So join us Thursday, June 16th, and get insights into the causes of pregnancy loss, the risk factors that could lead to miscarriage, and whether there are ways to prevent a miscarriage from happening. So join us Thursday, June 16th. And again, the recordings of all of our parental guidance webinars are available for you, as well as downloadable tips and resources at jacksonevents.org. So thank you again, Dr. Kleiner and Jennifer, and thank you, UHealth Jackson Children's Care, for hosting these amazing resources for us. We hope to see you in 3 weeks on June 16th.